So we'll start with talking about the legislation. So for those of you who were at the symposium, you got to meet and hear from Congressman DeSaulnier and Buddy Carter. Congressman DeSaulnier is a cancer survivor, and Congressman Carter is a pharmacist, and together they're co-chairs of the Congressional Cancer Survivors Caucus. And they're very committed to this legislation and to advancing the needs of cancer survivors. So we were thrilled that they introduced this legislation just yesterday, and we have a good group of organizations supporting it that we'll share with you soon. So we appreciate that this is a bipartisan bill, because a lot of things in Washington these days are not very bipartisan. If anybody happens to be watching hearings on TV today, you see that they don't work together very well. But we're really thrilled that Congressman DeSaulnier and Carter really do work together well and share a concern for cancer survivors. And so we're thrilled that they work with us on this legislation and introduced it, and it's something that's very important to them. So what the legislation would do would create a Medicare service for cancer care planning, and that would be at diagnosis and if there's a change in the treatment plan, and at the completion of treatment, a survivorship care plan. Sometimes people think this is just about survivorship care plans. It's definitely not. It is also for that treatment planning at the beginning of treatment when someone is diagnosed. But also, as we know, the treatment course may change because of progression or if a certain treatment's not working. So anytime there's a change in the treatment plan would be an opportunity for a new cancer care planning service. So how this would help cancer survivors is to really give them a written plan or roadmap, because as you all know who have experienced cancer, you as a patient really are the person who has to coordinate between all the different providers. And it's overwhelming to hear that you have cancer, to think about your treatment options, to know all of the different specialists that you may have to see, and then to coordinate between them. So while planning is very important, it's also about the coordination among other providers, and also the communication. And that was something that was really important to Congressman DeSaulnier when we first introduced this legislation, working with them last year, is the communication aspect, because he, as a cancer survivor himself, knows how important that is. And what this would do is provide more time between the physician and the patient, and to help with that shared decision-making between patients and their care team as they are making decisions about their care. And also empower patients with information that they need to help manage and coordinate their care so that they can take this information to their primary care provider. We hear all the time that primary care providers feel out of the loop, that patients, if they're diagnosed with cancer, they go off to their oncologist and they're treated by their oncologist, but the primary care provider doesn't know what's happening as the patient's going through treatment. And that makes it harder for them to help manage the care, and then also to help you as a patient after you finish your treatment, because they don't know all the things that you've endured as part of your treatment, and then the things that they need to be looking for going forward. So it's a really important tool not only for patients, but also to provide to their primary care providers to help keep them engaged in their care during and after treatment. So what you can do, you can call your member of Congress using just the Capitol switchboard, or if you happen to know their office number directly, you can call them. For those of you who have met with your members of Congress or staff members at the symposium this year or in past years, or even with other organizations, and if you have a relationship with that health legislative assistant, you can reach out to them directly and let them know about the legislation. You can share information on your social media, and you can also always tag your member of Congress on social media. They're very active both on Facebook and Twitter. So if you tweet, you can go to our Twitter and retweet some of what we have tweeted, and then you can tag your member of Congress and say, please support this legislation. You can ask your friends and family to call their members as well. And this is something that the more members hear from us about why this is important, then we can ask, what we're asking them to do is sign on as a co-sponsor with Congressman DeSaulnier and Carter as saying that they endorse the legislation. And then another thing you can do that's very timely is meet with your members of Congress during the August recess. So I'm going to let Rebecca talk to you a little bit more about meeting during the August recess.
Yes. So, hi, everyone. I'm Rebecca. So basically, just for August recess, members of Congress are going back to their districts. And this is a great time to meet with your representative because they aren't as busy. They don't have as much on their plate. They have basically like a more open schedule. And this is a time when they want to make sure that the constituents that are visiting them or that they are visiting are happy with what they're doing in Congress. So we suggest that currently, because the CCPCA hasn't been introduced into the Senate yet, that if you guys want to meet with your representatives, you meet with your House representatives, and the House representative in this district has multiple office locations. So before you call and schedule, you want to make sure that you're picking a location that is convenient to you. And so I'm not sure if you guys can see the slides yet, but we have slides that sort of outline how you can easily find an office location that works for you. And so one of the pictures on the slide, this just shows you can Google who your representative is, and they have a list at the top that basically you're going to want to go to the contact option. And then most of the time, once you click on the contact option, you'll see a drop-down list, and another option is office locations. You want to click on the office locations, and like we said, they'll have multiple. So basically that redirects you to a page with all of the locations. Obviously there's going to be a DC office, and there may be 2 or 3 other locations. And based off of where you are, your transportation, whatever is easiest for you, you just pick that location, and usually they will have a phone number underneath it, and you just can give them a call. I would do it probably like a week or 2 maybe in advance. Yeah, I'd give them a call a week or 2 in advance. You can set it up whatever schedule works for you. Also, if you don't feel comfortable doing this on your own, I am free to help you. And you could just email me it's cpat@canceradvocacy.org. Just give me your schedule, what times you're looking to go, the dates, and I will try and get in contact with your representative for you and set up a meeting. And then, so that's scheduling the meeting. During the meeting, it would be best, because our main ask is for them to support or potentially co-sponsor the CCPCA, we think it would be best for you to bring a copy of the fact sheet. And this, basically just bringing the fact sheet, you can leave it behind. That way, if they have any questions, that basically answers it for them. You can also redirect them to us as well if they would like to get in contact. And you can download this fact sheet at the website on the slide. And if you haven't met with your representative before, there are just some tips about meeting with a member of Congress. Obviously, you want to introduce yourself briefly. You want to obviously give your name, make sure that they know that you're a constituent, and mention your connection to cancer and why you're advocating with NCCS. And obviously, through the connection to cancer, you're going to mention that your main ask or the purpose of the meeting is for them to help support the Cancer Care Planning and Communications Act.
I'm sorry, I'm just going to interject here. Please don't say IR here.
Oh, yeah.
Sorry for that typo on our slide.
I am here.
I think we edited a previous slide that said we are here and forgot to edit both words. So sorry about that. Please don't say that.
Don't take that word for word. Yeah, and so obviously after I am here to talk about CCPCA, you can also share your story, which Shelley did a great job at the symposium giving tips on how to share your story. So maybe you want to...
Right. We have a worksheet on that about sharing your story in a nutshell, because often you have a short time for the meeting, and it's a great step-by-step kind of how to boil it down. I mean, you want to talk about your cancer experience, and I think if you have a little bit more relaxed time frame in these recess meetings where they're not, rushing off to a committee hearing, you might have a little bit more time to share your story. But you still want to keep it concise because you don't know how much time you're going to have. And you can always kind of start with like the very short version of your story, and then if they ask questions, talk more about it. But what helps is if you talk about, why either this would have helped you and why you didn't feel like you had the best care planning, or you didn't receive a plan, or you were confused about your care, or didn't have the information you needed to coordinate your care. Or if you did, then talk about how you had those things and why that's so important. We want to make sure everyone has access to that. So if you can talk a little bit both about your story and then also how it relates to care planning and communication and coordination of care, because that's something that I think everyone has a story about, either having a good experience with that or a not so great experience with that, and why we need to make the system better. Unfortunately, most of the time we hear the not so great experience with it, but if you had a great experience, then that's important to share as well. And we can put we can make sure that the worksheet on sharing your story in a nutshell is also on the Toolkit page. It may already be there, but if it's not, we can add it there.
Mm-hmm. Perfect. Yeah, and then so once all of that is said and done, then you have to present them with your ask. And usually, from my experience with the Hill Day visits, I thought it was easiest for people to be handing them the leave behind and presenting them with the ask as well. That way they can sort of visually see what you're asking and like take it in, hear it as well.
Yeah, I think it's also important not to bring too much into the meeting, so that's why we have like a 1 page or 2 pages or 1 page front and back fact sheet that if you had at the symposium if you were there. If not, you can download it from our website and print it, and we've updated it to show the new bill number, HR 3835, this Congress. But they don't want a ton of paper, but if you give them that 1 page, then it gives them everything they need to know to be able to they can go onto congress.gov and get the legislation text and see who else is co-sponsored and things like that. So that's a really simple and concise 1-pager that you can leave behind. So this page is, this just shows you the canceradvocacy.org/toolkit, where you can see this toolkit that gives you kind of step-by-step on meeting with your congressional district offices, and it'll have a link to the 1-pager to download, and also we'll add the 1-pager, the worksheet on how to share your story. I will just add, I was telling Rebecca a story that I went to a district meeting one time with a member who was chair of a really important committee. So he was in D.C., super busy guy, but we went to his office one day, and I don't know if we just got lucky or he didn't have as much going on then, but he's like, would y'all like to go out for barbecue? And so he took us out to lunch to have barbecue to talk about, we thought we were just going to be talking to him for 20 minutes, but he had some time on his hands, and we got to have a lengthy meeting with him. That is the kind of thing that's really hard to do in D.C. because they're pulled in so many different directions. And I also, this year is a good year to meet with them in August because they're not as focused on campaigning as they will be next year. Right. Not that they're not, the members of Congress and House Representatives have to run every 2 years. And, there's a lot of new members this year who are going to be, whose seats are not as safe as the, long-time incumbents. So they're going to be focused on raising money and things like that while they're home in the district, but they're also, spending time with their constituents. So they're just not, as focused on the campaign this year, and we'll probably have time. So it's a great time to meet with them. If you didn't get to meet with them when you were here in D.C., or if you've never gotten a chance to meet with them, it's their job and it's what they like to do. I think they prefer to be meeting with constituents than in hearings and committee meetings here in D.C., so they enjoy that, and especially when you're coming to talk to them about something like cancer that everybody understands and has been touched by, and you're not asking for, tax breaks for corporations or something like that. They like talking to real people about important, issues that people face, and this is also, the legislation is not controversial. It's widely supported. It's just hard to get people to pay attention to it because there's so many other competing priorities. So it's not like you're talking about something controversial. You're just trying to raise awareness of something that's important, that we hear is important to patients, and that's why we're pursuing it, and that's why we want this legislation to help improve care for patients. So in addition to the Toolkit page, there's also a canceradvocacy.org/CCPCA, which has all of our information about the legislation, and it also has the link to the fact sheet, and then it has a sample cancer care plan that you could take a look at, and you could take with you if you wanted to, but I think the one-pager is probably the most important thing. So if anybody has any questions, please ask them in the chat box. We're going to make this webcast available after we finish, so that if you're busy watching, congressional committee hearings today and not watching this, you can come check it out later. And you can always email us if you have any questions at cpat@canceradvocacy.org. No questions so far? All right, well, I don't see any questions, so I hope that means we were very clear, or that you guys are all pros and know all this information already. I know that some of you have already advocated for this legislation before, but if you don't know much about it and you want more, or if you have any questions, please email us. We'll respond quickly, and Rebecca is available to help you in any way. One thing that we didn't mention is, if you do meet with them, please let us know about it. So that we can help follow up with their D.C. office. It helps us to know what kind of questions and feedback you're getting. On the Toolkit page on our website, there's a link to a form you can fill out. It's just a really simple form that tells us how the meeting went. And also, don't forget to take a picture. If you meet with your member of Congress, tweet it, or you can send it to us, and you can tweet them and say thank you to them. And also, if you did meet with them when you were here in D.C., you can follow and told them this legislation was going to be introduced, then you can follow up and say it has been introduced. Thank you for your interest, and we hope you'll sign on as a co-sponsor. Oh, Debbie, question. If my representative already signed, should we meet again to reinforce the importance? So you can just thank them, and you can always meet with them to kind of build the relationship. I will say that at this point, if your member signed on the last Congress, we're starting from scratch with this new Congress. So at this point, Congressman DeSaulnier and Carter are the only members who have signed on as co-sponsors. So Debbie, I remember you got your Congresswoman to sign on last time when you were here for the symposium in 2018. So I think it would be great for you to make sure that they're aware that this has been introduced so that they can sign on. I have no doubt that they would be interested in this, because this is something, if they've signed on in the past, they're likely to sign on again. The legislation text is exactly the same as it was in 2018 when it was introduced. So if a member of Congress signed on before, there's no reason they shouldn't, because there's no substantive changes to the bill other than the bill number. So yes, you can definitely, if they've signed on before, it's definitely great to reach out to them, let them know that we appreciate your support in the past. Can you co-sponsor the new legislation. And we'll be reaching out as well to all the former co-sponsors, but, you know, again, they want to hear it from you, their constituents, more than they want to hear from us. Desiree, the one page